One of the most common things I see is people waiting too long to get symptoms checked. It's not because they don't care, but because they're not sure if what they have is serious. I want you to know the red flags that we are looking for. So in this video, I'm going to explain when symptoms like breathlessness, fatigue, or swelling are something that you should actually get checked and when you shouldn't ignore them. The reality is that these symptoms are very common. People experience them for all sorts of reasons, so it's not always obvious when something is important. The first thing I want you to look for is progression. If something is getting worse over time, that's important. For example, if you're becoming more breathless than you were a few weeks ago, or your energy levels are dropping, that's your body telling you that something is changing. The second thing is how much it's affecting your day-to-day life. If you are finding that things used to feel easy and now they're more difficult, like walking, shopping, climbing stairs, that's something to take seriously. The third and probably the most important is when the symptoms come together. Breathlessness, fatigue, swelling. Individually, they may not mean so much, but together they form a pattern. Another important sign is difficulty lying flat. So this one is often a red flag of more serious heart failure. If you're needing more pillows or waking up short of breath, that's something I would always take seriously. The reason people delay is because these symptoms are easy to explain away. People think it's age, fitness, just being tired, but your body is often giving you important signals. If you recognize these patterns, the most important thing is to get checked. It doesn't mean that you have heart failure, but it does mean that it's worth investigating. And the earlier we identify the problems, the more we can do. This is something I see regularly. People have had symptoms for some time, sometimes months, but weren't sure if they mattered. And once we assess them, we can put a plan in place. If you're unsure, it's always better to ask the question than to ignore the symptoms.